Hello, my name is Austin Medlin, and I will be presenting research regarding the COVID-19 pandemic and its impact on borderline personality disorder symptoms among college students. So borderline personality disorder, or BPD, is characterized by internal and external instability and is associated with significant psychosocial impairment. Some symptoms would be chronically feeling empty, distrust of others, or extreme impulsivity. It has also been well documented that BPD is associated with stress, where increases in stress can result in higher rates of BPD symptoms. And as we all well know, this current COVID-19 pandemic has greatly increased the amount of stress the entire population is under. So the current study is aiming to understand the relationship between anxiety related to COVID-19, the coping styles surrounding the pandemic, and BPD symptoms. We currently have three hypotheses for this study. First, COVID-19 anxiety and BPD will have positive correlation. Second, COVID-19 anxiety will be related to ineffective and harmful coping methods. And similarly, our third hypothesis is that BPD will also be related to ineffective and harmful coping methods. Our data is coming from undergraduate students at Oklahoma State University, where we currently have 74 participants in our data set. This is preliminary data, and so our future sample size will include 250 participants when we are finished. Currently, the average age is 20 years old, while the sex of our participants is predominantly female, with roughly 80% identifying as female. A little bit more about our sample characteristics. In terms of sexual orientation, roughly 2/3 of our participants identify as heterosexual, while roughly 3/4 of our participants are white. And in terms of housing, half of our participants currently live in on-campus housing or dormitories. And on a 5-point Likert scale from very happy to very unhappy, in terms of housing satisfaction, the mean is 1.85. For our analyses, we used three different measures. First, the coronavirus anxiety scale, which is a new 5-item scale evaluating anxiety surrounding the current pandemic. And for our sample, the mean was a 1.7. Second, we used the MSI-BPD, or McLean Screening Instrument for BPD, which is a validated 10-item scale used to evaluate BPD symptoms as well as diagnose BPD in clinical settings. One interesting fact that I want to point out is that for this sample, the mean for the MSI-BPD was actually a 6.06, which was significantly higher than we had anticipated. And lastly, we used the brief COPE scale, which is a 28-item scale with 14 subscales listed below that are used to measure different coping methods, both effective and ineffective. Also, all of these measures were self-report, and they were collected through the SONA system, which is an online survey platform that is being utilized by the psychology department at Oklahoma State University. For our preliminary results, we ran correlation analyses through the R data analysis software, where we looked at the CAS and the MSI-BPD and their correlation to the 14 subscales in the brief COPE scale, as well as the CAS itself. I would like to note that correlation coefficients on this chart with 1 star next to them are statistically significant for p less than 0.05, while correlation coefficients with 2 stars next to them are statistically significant for p less than 0.01. So some of the conclusions that we are drawing from these results are that 1, currently there is not a statistically significant relationship between the CAS and the MSI-BPD. There are, however, statistically significant relationships between the CAS and MSI-BPD with brief COPE subscales. More specifically, the CAS is related to denial for p less than 0.01, as well as planning, religion, and substance for p less than 0.05. Likewise, the MSI-BPD is related to behavioral disengagement and self-blame, both for p less than 0.01. I want to note again that this is preliminary data with n currently equal to 74. At the conclusion of our study, we will have n equal to 250 to examine these relationships further and see if the currently significant relationships remain once we get a larger sample size. Also, we will be adding into our future analyses the ISAS, or Inventory of Statements about Self-Injury, to examine NSSI, or non-suicidal self-injury, along with the CAS and brief COPE subscales. Thank you.